and welcome to episode 60 of the Dental Realist Podcast. I am Dr. Ryder Waldron. I'm joined, as usual, by Dr. Marcus D. Neff and Dr. Troy Stevens. Troy, how's it going tonight?
Living the dream, buddy. Living the dream.
Knew it.
Had a great day today. Today I had a day off, and it was really
No
nice.
dentistry's a good day.
No dentistry today.
Marcus, how are you doing?
I'm doing all right. Been a busy week. We had a couple of new dental assistants start this week, so
Nice.
always an adventure when you get new people on board and get to
Yeah,
know.
so last time we talked, you were looking for a couple of assistants, so it sounds like you found them.
Yep, found a couple more assistants, so been a busy week, but now I'm at the weekend. We got a long weekend, no work tomorrow and Monday off, so. And the
Nice,
Eastern
that's
Idaho
nice.
State Fair is in town, starts this weekend. Y'all might want to come and check it out.
I never miss it. You know me, I never miss it, except for the last 45 years. But yeah, I'll probably, you know me, Marcus, I love a fair. So, guys, when we
Marcus.
started this oh, sorry, go ahead, Troy.
I was going to ask him real quick. How did you find your assistants? What avenues did you guys advertise in the paper, Facebook? How'd you do it?
I just had a guy out on the road shaking a sign and no.
Dressed up in a tooth costume?
Yeah. No, we had a couple of ads run. It took like over a month. It was a couple of months probably.
Wow.
And we had a few people apply along the way. We ended up hiring one of them with 0 dental experience. The other one has maybe a year or so of dental experience. So
Nice.
yeah,
So the one with 0, literally no schooling or anything?
no schooling. She was working at Hobby Lobby for the last 3 years.
I'll be darned.
So
Yeah, well, to be honest with you, that's kind of the whole pulse out here. I think it's really tricky to find dental assistants right now.
it is.
Yeah, tough to find. Yeah.
It is.
It's hard. All right,
Well,
sorry,
guys,
Ryder. How
no,
was
you're
your
fine.
week, Ryder?
It's been awesome, and I'm excited to talk some dentistry tonight. So, when we started this podcast, we wanted to help new and future dentists, but one thing we don't know about right now is the current state of dental school. So, we thought we'd bring on one of the best and brightest at Marquette University School of Dentistry. We are going to be joined tonight by Melissa Drab. She is a fourth-year dental student at Marquette, class of 2022. She's a past president of Marquette ASDA. So, Melissa, how are you doing tonight?
I'm great. Thanks for having me today.
Yeah, we're so happy to have you. We are excited to have a dental student on here, especially one from Marquette, where we graduated from. So let's get right into it. First of all, I just want to know what made you want to become a dentist.
Yeah, absolutely. So like a lot of people, I had a really great dental experience growing up. I guess that was in part because my mom was a dental assistant. She still is. So going to the dentist was fun because you get to hang out with all of mom's friends.
Nice.
But I guess I got more into it in high school. We had to choose a place to intern, and the most obvious choice for me at the time was the orthodontist office that was right next to my house. We were neighbors basically. So I chose that place because it was easy for me to get to for my internship, and just fell in love with it more and more from there. And from there, I just continued assisting throughout college and visiting a lot of different specialist offices through different internships and assisting experiences. And I just really enjoyed everything that dentistry had to offer. Obviously, we all go through a ton of science classes and all of that getting into the profession. But as I learned more about dentistry, I realized that there's so much more, many different skills and professions that go into it. Like, I always enjoyed art. And as we all know, dentistry is a lot of art as well, interacting with people, leading a team, problem solving. And then obviously getting to wear scrubs every day was a pretty good deal too. So
Yeah, going to work in your pajamas always is nice.
yeah, good for
Marcus,
the day
you went to dental
running
school in
late
your
to clinic.
pajamas.
That's right. Hey, so being in a dental office as much as you were, it sounds like you had a lot of exposure to the profession. Was there anything along the way that you thought, maybe this, I'm enjoying this, but maybe I don't know about this part of dentistry. Maybe I won't like that. Was there any of that?
Yeah, I definitely got a lot of different perspectives. Like I mentioned, that ortho office was the first one I interned at. throughout college, I assisted at a general dental practice, and I took some opportunities to either shadow or intern at different specialties as well. So there's tons of different ways that those all work. One of them was an endo office where, I would come in for a morning and maybe observe 1 or 2 cases for most of the morning or even the day. Whereas then, ortho, you see so many patients running in and out of the office. So I definitely got to see a lot of different perspectives. And at the time, I don't really know if there was anything in particular that stood out to me as I don't really like that, but I for sure got to see the huge variety in dentistry.
That's, yeah, you see a lot of different things depending on the office you go to. I mean, dentistry's dentistry in a sense, but there's a lot of variety in terms of the way the different dentists practice, the way the staff interacts, the scope of what they want to do within their practice, for sure.
Exactly.
So you mentioned that you were a dental assistant before dental school. That's awesome. What about the differences between the dental assisting school and dental school? Have you noticed? Do you enjoy them equally? Are you still kind of enamored with it? Has it changed any of your opinions of dentistry?
Yeah. Well, I actually did not go to school for dental assisting. I just kind of helped out in the office in any capacity I could. I was able to assist chairside, but didn't go to school for a formal dental assisting training. But it actually did open my eyes when I went to dental school and learning more specifically about the different techniques of assisting and just being on the other side of the chair for once. It definitely opened my eyes a little bit. And there's a lot of things that you see when you're assisting without the dental background that, you don't really fully understand until you get to learn about it yourself in dental school. So definitely was a good inside scoop into what I was getting myself into, but I learned a lot coming out of that as well.
Yeah, that's great. I actually applied to try to get a job as a dental assistant so I could get some experience, before I went to dental school, and I couldn't get a job. So
You'd be able to nowadays.
You probably have better luck at that. Yeah, nowadays you have a lot better luck. That's for sure.
I'll tell you what, I was like, man, how am I going to know that I like this? I can't even get a job as a dental assistant, but they let me into dental school. It's kind of weird.
Yeah. Oh my goodness. Well, I guess for students that are trying to get into dental school and hoping to do the same thing, I was lucky enough that I was able to connect with a dentist that I had been a patient. I had been a patient at that office for my whole life and had some connections with my family as well. So even just reaching out to the dentist that you're familiar with could be a good bet. And I know it's tough to get assisting jobs sometimes, but just that shadowing is so helpful.
Definitely. Hey, Melissa, so do your classmates know that you used to be a dental assistant?
Yeah, it's come up, definitely. I think I've enjoyed having that experience because it definitely helps me with some of the things that I've seen a lot of classmates struggle with. We all definitely have our strengths and weaknesses, but I've enjoyed making the provisional crowns, and I think that having that dental assisting experience and having some time in the lab gave me a leg up for sure. So yeah, it's been
classmates always try to steal you to come assist for them.
Oh, yeah. Well, that's actually interesting. Now with COVID and all that, I guess we can kind of get into how the clinic has changed a little bit. Now they really encourage assistance for almost all procedures, especially those producing aerosols. So it's always a challenge finding a dental assistant, and everyone's asking around for one at all times.
Yeah. So you've had, I mean, this has been probably quite a change for you because you started dental school long before COVID happened, and then it started last spring. So what kind of changes have you noticed, especially in the clinic, but also with, the classroom work? What have you noticed has changed the most with COVID?
Oh, wow. Well, yeah, what a change. I remember right as COVID was kind of creeping up on us, I was at the ASDA annual session conference in St. Louis, and we were electing new leaders for district positions and even interviewing them with silly questions like, oh, if COVID-19 would hit your school, what would you do to combat it? Not knowing that in a couple of weeks, it would all kind of become a serious thing around here. So our spring break turned into, an extended spring break, and we were all happy we didn't have to take our removable exam that Monday. But
Nice.
We were out of school for a few months. My class was supposed to start clinic that summer in June, but we didn't end up coming back to class until June, and we had to catch up on all of our sim lab courses that we missed in the months prior and all of that. So in total, we lost about 3 months of clinic time. So coming back and finishing up our D2 year, transitioning into clinic, it was a lot for sure. There's already a lot to learn transitioning into clinic as is, and then everyone's kind of learning at the same time, including the faculty, the staff, the dental assistants, the receptionists. There's just so many new protocols, issues with, capacity and PPE, new protocols we had to learn. So it was for sure an adjustment for everyone. But, as every dental school was, I'm sure there were just tons of moving pieces trying to move it along for us so that we could keep moving forward. But, those first few months that are supposed to be used up for, meeting your new patients, doing your initial exams, getting some of those prophies out of the way, it was all pushed back. So our class didn't really get to hit the ground running until fall. So I think it definitely lit a fire under our butts. For sure, our class got a little extra motivated to work hard and try to push forward, make up for that lost time, and just take advantage of any clinic time we could going forward.
Smart. Yeah, that's great.
That's a challenging thing. I'm trying to think back, when we transitioned from second to third year, man, we were flying through the clinic at that time. That's kind of, I don't know if that's still the way it is. Third year, you really start doing heavy clinic stuff.
Right.
And not be able to do that. That's tricky. So what have you enjoyed most about your dental school experience thus far?
Well, obviously the clinic. I love the clinical dentistry, but one thing I really loved about the school I picked, going to Marquette, I love the camaraderie with all the students. I'm sure you all had the same experience, just getting to experience the trying times and the exciting times of dental school together with good friends that are also in the trenches with you, just going through the thick of it. So that's been awesome, and just getting involved in things at school, like ASDA was a big one for me. I really enjoyed getting involved in organized dentistry and moving towards hopefully getting more involved in the ADA after graduation. Marquette has such an awesome chapter of ASDA, and beyond organized dentistry, there's so many things that the organization has to offer. So I've really loved that in dental school, and it just really extended the big family component of Marquette and the great experiences in dental school.
Yeah, those experiences and being together with people. I mean, the three of us, Troy and Ryder and me, that's where we first met, was in dental school, and it was through all that
magical
shared turmoil of dental school, studying. Yeah,
that's awesome.
It's true.
Lifelong friendships.
Absolutely.
So tell us, what does a day in the life of a fourth year dental student look like these days?
Yeah, so like you mentioned, all the years are a lot different. Transitioning from D2 to D3 is such a huge change. Now D4, basically I'm looking at full-time clinic. We have one class that's an hour on Thursday mornings, and that one's about practice management and more of the business side of dentistry. But aside from that, it's pretty much clinic 24/7. So in our clinics, it's obviously we're seeing patients, but it's a lot of other stuff that goes in between. So before your patients, you're setting up the ops for your appointments. In between your patients, you're treatment planning, scheduling appointments, working on your lab work. So you kind of get to do all the jobs within a dental office here at the dental school. So we get a little bit of all of it. It definitely gives you an appreciation for all the different jobs within a dental team.
For sure. It's a busy time.
Oh yeah, definitely busy.
Yeah, so I've got a couple of questions here, Melissa. So the first one is, do they still give out the Tom Lauer Award to a second year dental student?
No, I don't think I know what that is.
Okay, well, we have a Tom Lauer Award winner here. It's Marcus. It's basically the student who kind of sucks up the most to the professors and whatever. But anyway.
No, I'll have to bring it back. I do have a classmate though that the first couple years of dental school, he liked making superlatives for our class. So at the end of every semester, he would come up with superlatives for, he'd pick like 30 different topics and pick some students from our class to highlight. And there were always something funny like that. So maybe we'll have to bring that one back.
Yeah, I can't remember what the story was. Marcus probably knows. I think he was a dental student at some point, wasn't he, Marcus? Tom Lauer? And
yeah, he was a dental student. And I mean, it has kind of a sad part to it. I honestly don't remember from what, but he passed away in dental school.
Yeah.
Apparently he was a nice guy.
Oh, wow.
Good guy. So they created this award in his honor.
And Marcus was voted that.
Awarded it. So there you go.
Yeah. So, Melissa, you talked about some of the good things in dental school and how, friendships and camaraderie and things like that. But what has been one of your biggest struggles or a few of your biggest struggles in dental school? Because it is definitely stressful. It's not fun all the time.
Yeah, that's for sure. Just adjusting to all of the changes and challenges that dental school has to offer. I feel like you get a little bit of that every year. I know that coming to dental school, I always say that you can't be 100% prepared, no matter how much you did in undergrad. Dental school is just a whole different beast. So definitely adjusting to that course load and managing how to study and all of that with everything that's coming at you from every direction. I mean, D1 year, it's just so many lectures, a lot of science classes, and then you just get some of those lab classes and clinical rotations mixed in. But just knowing how to juggle all of the crazy course load that's coming at you, and then moving on to clinic, it's another whole adjustment with trying to manage your patients and fill up your schedule and balance what procedures you're doing. So that's probably been the biggest struggle. For me, I definitely had the hardest time that first year with all of those science classes, and I had a greater strength in the sim lab, and now in clinical practice, I find that I do a lot better in those aspects, whereas I have classmates that will say that D2 fall semester with fixed prosthodontics and removable was like the worst semester of their life. So everyone's completely different, and just adjusting to those struggles and the things that you find most difficult is definitely a tough part of dental school. But it's just great that we have a solid group of 100 people that are going through it with you, and someone is probably there that knows how to do it a little bit better than you and can help you out with whatever you're struggling with.
Yeah, that's awesome. Because I mean, you, Marcus and Troy, you can probably remember the end of that our first semester of dental school. I think we had 14 finals in like 10 days or something like that. It was just nuts. Yeah. So I mean, you got to really be a time manager. So.
And the very last one on Friday morning was Dr. Siebenlist biochemistry.
Oh, was it?
Oh, no.
It was the very last exam, and we were all just like wiped.
Wow. I don't know.
Siebenlist, I don't know. Do you guys still have him, Melissa?
No, I don't even recall. I don't think we did a biochemistry. I'm sure it's kind of integrated into some other courses. Like we have like physiology, pathology, things like that, but we don't even have a straight on biochemistry class anymore, which for me, it's for the best.
Yeah.
Not complaining about that one.
Well, we went to dental school back when we actually used textbooks.
Oh,
And we did not do laptop. Well, we had laptops, but none of our books were on laptops. None of them were on iPads, all that stuff. None of that stuff was around really.
Yeah.
The iPad is definitely my best friend.
Yeah, that would be an interesting thing. I've always heard that, you don't retain as much information reading off of an electronic device. I read off my iPad all the time, but there's something about buying a $150 book and just going thumbing through it, and then throwing it away after the semester's over.
Oh yeah.
I still have mine. I still have my books. What are you talking about?
I took them to my office and they're collecting dust on the shelf.
Yeah. I pulled out I think it might have been a pathology book the other day. Yeah.
Actually, try to reference something or?
Yeah, I tried to look something up. I can't remember what I was looking up now. Of course I can't. But I don't have a biochemistry book, because if they were going to eliminate a class in dental school, that's probably a good class to eliminate, because I'm not sure how helpful that was.
Well, you remember
Yeah.
Stephen List. He thought that the dentistry should be like a 6-month course. That,
Yeah, yeah,
we didn't know enough about science and stuff, and
yeah,
he always gave us a hard time.
yeah.
Oh man.
Yep.
It was kind of funny. Yeah, I don't think he liked dental students.
He did
But
not.
yeah, but that was an interesting time. I'm wondering how many other professors are still there. Is Waliszewski still there?
Mike is, I think. Son.
No, he's not, but he actually has come in for some guest lectures before.
Has he?
Yeah, he's not here full time anymore though. We have some new faculty taking that place, but yeah, I mean, even just looking at the D1 schedule right now, I even am getting flashbacks to my D1 year. You know, you try to put that in the past and forget about those 14 finals in a short period of time, but yeah, it's crazy to look back at that now, having just one lecture a week. It's a lot different.
That's awesome. Yeah, fourth year seemed to be a lot more structured to more everyday, real day life stuff. But just so you
Right.
know, until about 10 years out, you'll wake up with cold sweats, wondering if you have ever taken your boards and if you're going to pass. It's just like you're like
my
freaking
gosh.
out. I mean, remember those days, guys?
I still have nightmares, guys.
Every once in a while, you just wake up and you go,
Yeah.
"My gosh, I'm not going to pass my boards."
I recently had a dream that I had to go back to dental school at Marquette, and I got there and I was thinking, what am I doing here? And my wife and kids were staying back, and I'm like, why aren't they coming with me? And then I could not figure out why I was going back to dental school because I was fully licensed and everything, but I got sent back for some reason. So, you know, it may happen. I don't know.
Goodness.
Yeah.
What a nightmare.
Yeah.
Yeah.
Sometimes people
Well,
might see my work and want to send me back to dental school.
It's so stressful, you know. I think that's why it still lingers in the back of your brain even after years and years and years of being away from it. So
Yeah, absolutely.
Hey, Melissa, so you are currently the president of the ASDA chapter, is that right? Or you were?
So right now I'm the immediate past president. The way that our chapter works is we do a year-long president-elect position, and then that you kind of follow the president for a year and work hand in hand with them. And then next year you advance to president, and they have a new elected person below you. So it's a really great way to kind of transition into it and keeps our chapter moving even in those transition periods of leadership.
So I recently saw, I think it was a Marquette ASDA video where everybody was singing and dancing to.
Yes,
Part of that?
we're famous for those videos. They're so fun to make.
As a man who likes a good musical, I can appreciate that. And
Yeah.
I'm wondering why that wasn't around when I was at Marquette.
You would have
I
starred,
know.
Marcus.
Because they didn't have video
call you back
cameras.
for a guest appearance.
Yes. Yes. Can we get Melissa? Can we make that happen? Can we get Marcus in one of those videos? I would pay for his flight to get him there.
I'll pull some strings. I think I can make it happen.
I think Troy and I could really get him back there for that, and that'd be a dream come true for all of us, I think.
And for me.
Yeah, absolutely.
Yeah, I would love to see that.
Can you talk a little bit, Melissa, to what role, what value ASDA has added to your dental school experience?
That's a good question.
Oh yeah, absolutely. So much. Well, I got involved in our ASDA chapter before I even started the D1 year. They invited some D1s to their annual leadership retreat, and I joined in on that. And they automatically just welcome everyone. Everyone is an ASDA member, and the ASDA leadership team is just so big, and there's a lot to get involved in. So we had anything from the legislative branch that helps you learn about topics in dentistry and lobbying for dentists and dental students and the more organized dentistry aspect of it. But then we had things like the music video committee that made those videos that we were just talking about.
Heck yeah.
And, like lunch club that was basically like a potluck we would have every Monday, or health and wellness, and they're actually organizing a huge beach volleyball tournament for this coming week. So there's so many aspects of it that just really helped knit together the camaraderie of Marquette, and then also just teach you so much stuff that doesn't fit into those crazy 4 years of dental school. Dental school is packed enough as it is, as we've covered already. It's just like so much to even fill into those 4 years, but there's so much more to dentistry that you can learn in school and beyond during your years of practice. And AS has given me a lot of that as well, when it comes to leadership or information on practice management, just learning about some like post-grad options, just anything that you want to learn more about, as is a really great avenue to get there. So I really enjoyed being a part of it during dental school so far.
So I want to
Awesome.
ask you about life after dental school. Have you made a few questions here? Have you made plans for life after dental school? I'm curious about what the job prospects are like in the dental market now. And does the dental school help you find jobs or find, I mean, if you go on to, continuing your education or anything like that, can you just give us
Yeah.
some insight into that?
Yeah, absolutely. So I'm just kind of starting to explore options for after dental school. Right now, I'm leaning towards looking for an associateship. I'm looking forward to start working and being a part of a team and experiencing a lot of different dental office models to hopefully ultimately become a practice owner. So I'm really excited about looking into that. But like I said, I just kind of started looking for opportunities and trying to figure out how to navigate looking for jobs and all of that. So I can't really speak too much towards what prospects are looking like now at this point, but the school does offer some help with that. Our school recently hired a practice manager. Well, I guess she's kind of like a practice management person in our student services. So she's able to find some jobs in the area that are potentially looking for dentists, help us get connected to residency opportunities and things like that. Basically anything post-grad that you have a question about, she's kind of the go-to contact person. So that's been really helpful in the last few years and just helping us dive into considering things post-grad. And we also have some graduate programs at Marquette. So just having those on campus is helpful to get some questions answered if you are someone that's interested in a particular residency. So there are ways to get some information about those, but yeah, just figuring out how to even go about it is probably a challenge for a lot of my classmates, just like myself. And we've been students for so long, so now trying to figure out what we want to do post grad and how to get there is the next challenge for us.
Yeah, that is crazy because you go from having somebody look over your shoulder and check everything off all the time for, 4 years or how, and all that clinic time, and then you're just licensed and ready to go and you can do whatever you want. You don't have to check with anybody. It's a pretty cool dynamic, but it's a little intimidating,
Yeah.
I think.
Oh,
Yeah.
absolutely.
Yeah.
It feels weird for sure, but exciting at the same time.
It is. So we had a Marquette grad come and work with us for about a year, I think, as an associate. It was kind of cool to touch base with him. It's been several years ago, but I felt like Marquette did a really good job at preparing me for a just a good safe starter, I guess you could call it. I didn't feel extremely overwhelmed with stuff when I got out of school, and we've had several associates that when they come out of school, they've been super nervous about stuff, and they just haven't had the confidence to make decisions like, oh my gosh, what do you guys think about this, instead of just going for it. So I thought Marquette did a pretty good job getting me on my feet. I don't know what you guys thought.
Oh, absolutely. Yeah.
I felt like I was a safe beginner.
Yeah,
Exactly.
and we got a lot of removable prosthodontics work, it seemed like, at Marquette. Not as much like endo or anything like that, but so I still feel pretty confident doing a lot of removable stuff, which with implants and things like that, we probably don't do as many nowadays, but I still don't mind doing a denture here and then, guys.
You like it. You've
I
mentioned
really
it
don't
over
mind
and
it.
over again.
And the thing is that if I mess something up, I can always send it to the lab and have them correct it. So it's really nice. And I don't take my impressions in rubber base anymore since dental school.
Or what is that, reversible hydrocolloid?
Yep, none of that either.
That stuff was horrible.
Yeah, Melissa, did you guys in your removable lab, did you guys use rubber base or anything like that to take your denture impressions?
No, they're all PBS impressions.
Oh, that's so nice.
Hallelujah.
That is
Life
so
is
nice.
involved.
When you're doing your crowns, do they let you do quadrant trays, or do you have to do full upper and lower arch and mount it on a face bow with an articulator?
Full upper and lower arch, but no face bow if it's just a single crown. You can just put it straight on the articulator. Yeah, but still are going full on with the snap.
Yeah, those are some of those things that you've just learned in school that you'll never use again.
Yeah.
It's true. It's
I
true.
mean, good to know how to
Good to
get
know.
to that,
It is good to know.
you know, all of
But
that lab
man,
work. But I'm excited for the day where I don't have to do all those steps anymore.
Yeah. It's
yeah,
amazing.
for sure. And then, you know, it's a good thing to know some of that stuff just because it helps you, you know, solve problems in the future and things like that. But yeah, Dr. Walszewski would be very, very mad of what I just said.
Oh,
Yeah.
yeah.
You do not need a
Yeah.
full arch impression for a single unit.
No, and I did an 8-unit bridge yesterday, and I also didn't do a Facebook transfer. I don't even know. I think my
How do
Facebook
you
might
live
be
with
so.
yourself? I mean, wow.
Well, it took about an hour and a half to do that. It would have taken about 6 months in dental school, so I lived just fine. But yeah. Melissa, what made you pick Marquette to go to dental school?
Oh, that's a good question. I did interview at a few different schools, and automatically Marquette just stood out to me with how I felt at the school. Everyone, like, just, you know, going back to that feeling that you get with all the students here, it was just different. A lot of dental schools I feel like could have that competitive nature or just be
Hmm.
kind of almost like feel depressing when you go in there, for lack of a better word. But I feel like although you're going through a lot of stressful times in dental school, Marquette students have a great attitude and a great way to get through it together, and they have a lot of fun times, even though it's a lot of stressful times as well. And we can all, you know, have a fun time getting through it together.
That's awesome. You know, here we are 18 years after we graduated, and you're still describing the same experience I think that we had.
Yeah.
Man, our class was awesome. You know, we had a lot of cool people in there, a lot of friendliness. You know, yeah, there was those guys that were, you know, trying to be surgeons and orthodontists and all that stuff, and they worked really hard, and some of us kind of messed around a little bit too much probably. But you know, I mean, it was a really good, awesome experience. And like, you know, Marcus and Ryder and I, we met there, and we've been friends. We talk every single day. I
Yep.
mean, you know, and for 18 years, I think we've talked every single day. So
Yeah.
That is
it's
awesome.
just pretty awesome, you know, that's still the environment there at Marquette. So any listeners that are looking to do that, Marquette's a great school to look into.
Yeah, and
Yeah.
we went to school with Dwayne Wade, NBA champion 2 times.
There
That's
you go.
right.
Yeah.
That's right.
Yeah. Yeah. So, we have that going for us.
Yep.
There you go.
Yeah. So,
Yeah, and like, you know, like Brian says all the time, you know, a lot of dental schools, they share best practices, and if one dental school is doing something great clinically, then a lot of other ones will follow. So maybe there's not, you know, a huge list of things that set apart one dental school from another or make Marquette so much better, but it's just those, you know, exactly what we're describing, those connections and faculty and students, and just, you know, the town in general. Milwaukee's a great place to live, I think, and I've enjoyed it.
yeah.
So that makes dental school a lot more enjoyable as well.
We were the first graduating class out of that new school. Well, it's
Yeah.
not so
Oh,
new
wow.
anymore.
I think they've had some
We did
additions since.
3 years in the old school, and then we were the first graduating class out of the new facility. We didn't get a chance to use all the new latest and greatest technology in the labs and all that stuff because we were already into clinic and stuff. But yeah, that was pretty cool to be able to experience that. So,
Have you been able to come back and visit?
I have not actually. I think, did you go back, Ryder? Or was it Mark?
I have
Yeah.
been back. Yeah. And I went back to, I think our 5-year reunion, and I haven't been back since. But yeah, I really like Milwaukee. I thought Milwaukee was a great town. It's cold in the winter times and really humid in the summer, but I liked that it had a lot of culture. It's an older town. It has a lot of history to it. Not old in a negative sense. Chicago is real nearby. I mean, I thought it was great. To live in Milwaukee for 4 years. I thought it was really a pretty cool town. It's got a lot of major league sports and everything. You got Lake Michigan right there. Like 20 minutes away from Milwaukee, you can be in the country. So yeah, I thought it was a great place to live.
Yeah. We did a rotation up in Green Bay. Do you guys still do that?
I don't think we have one in Green Bay, at least not recently. A lot of those external rotations have been put on hold when COVID hit, but we do have
Right.
one in Appleton and one in, I believe it's like Eau de Claire or something like that, Eau Claire.
Okay.
There's
Yeah.
a couple different ones with external clinics that we're able to rotate through.
We had two or three. I don't think we had Appleton or Eau Claire or anything like that. Did you guys go out there?
No.
I
We
don't
did
remember
the
it. No.
inner city clinics in Green Bay, if I remember right.
Yeah. What was that inner city clinic called that we went to? Can't
That's a good
remember.
question. I don't know. I don't
The
know. There
number
were two
two
of them.
Roundberg guy.
Yeah, I don't know.
What was?
I'm
Oh
not
my
sure.
goodness. What was his name? Doctor.
Jack
It's not.
Sneesby.
Remember? Jack
Jack
Sneesby.
Sneesby. Yeah.
Dr. Sneesby. Yep. I think he's passed. So
Yeah,
anyway,
well,
sorry, Ryder. Didn't mean to cut you
No,
off.
I was just gonna, before we wrap up, I was gonna ask you, Melissa, if you could talk about student loan debt. I'm curious what students are coming out of dental school with as far as debt goes nowadays, and if you feel confident that you'll be able to pay that back in a reasonable amount of time.
Yeah, that's a great question. Definitely something that's on a lot of our minds lately. It's been great because the one silver lining of COVID is it put our loans on hold, so to speak. So we're not
Yeah.
collecting interest right now, which is huge because we are not paying off the loans yet, obviously. So that's really great. I think that a pretty average number for loans coming out of school, at least for people going to Marquette, potentially having some undergrad loans as well, is close to 250,000. So right around that number is pretty common for a lot of people coming out of dental school, and it's a really intimidating number when we think about it. I hope to be able to pay that off. I mean, it's hard to say confidently, but I think that a lot of us are planning out our post-grad plans in a way that will allow us to work that down as quickly as possible. And that's another thing to navigate and hopefully get some advice on coming out of school in terms of planning our post-grad careers and financially figuring out how we're going to work that down. But that is definitely something that every dental student's facing these days. And it's a huge number when you think about it.
Yeah, and actually 250,000 it's a lot lower than I thought it was going to be, guys, because we have a private school here in Utah that students are graduating between 350 and 400,000 in debt just from dental school. So 250, I mean that's manageable, I would say.
Yeah, that's not bad.
Yeah, and Marquette's a private school, and you get a really good, solid education. It's been around for a long time, so yeah, I'd say that's not bad, even though it is very intimidating. Yeah.
Yeah, absolutely.
Yeah.
Yeah,
Well,
it's super intimidating when the reality is that insurance companies can dictate how much we make.
yeah, and that's a
That's a
concern too.
topic for another day.
Yeah. Yeah. Do you guys have any more questions?
That will be another episode.
Yeah, probably 5. Do you guys have any more questions for Melissa before we wrap up tonight?
I don't.
Melissa, just wrapping up here, what would be some of the just quick little nuggets of wisdom to those folks who are maybe considering dental school right now in 2021? What would you tell them?
Ooh, that's a good question. Well, I think we really hammered on the fact that dental school is challenging. So I don't want anybody to listen to this and think like, kind of scare themselves away from it. Absolutely not. It's definitely manageable, and you're with a big group of people that are going through the same thing, and you can absolutely do it if you love dentistry. Like we talked about the debt, if you're in it for the money, probably not the best way to go. But if you love teeth, you love treating patients, this is an awesome profession. I'm really excited to enter it in as a professional and not a student anymore, and continue to meet more doctors and become involved in professional organizations and just be a part of the community.
Absolutely.
Fantastic.
I mean, that makes me feel better about my dental school experience, to be honest. I mean, like, it was stressful. Looking back on it, I think, man, how did we make it through it? And then, talking to you, Melissa, it's put a real positive spin on things. So we appreciate you being on and joining us tonight.
Thank you so much for having me. I really enjoyed it.
Thank you so much for your wisdom. We really appreciate you coming on tonight.
Yeah, thank you.
Yeah, it's good. Us old, Brian Trechik likes to say he's an old war horse, and old war horses like us, I mean, we get kind of cynical and negative about stuff sometimes. So having a positive spin on dentistry has really been great. So we really appreciate you, Melissa, being on with us tonight. So we'll
Thank
wrap
you
up,
so
guys.
much.
Marcus, why don't you tell everybody where they can find us and get in contact with us?
You can reach us at dentalrealist@gmail.com. We'd love to hear from our listeners. If you have questions, topics you'd like us to touch on, definitely reach out to us. We appreciate hearing from you. We have a couple of books you can check out. So You Want to Be a Dentist is the first book we published, and the second one is So Now You're a Dentist, both with a lot of good information, quick, easy reads. So you might want to check those out.
Yeah, and once again, we appreciate Melissa Drab being on with us on episode 60. And this has been the Dental Realist Podcast, and we'll talk to you on episode 61. Thanks.